Hello, fellow YouTubers. Today I want to tell you why Obamacare should not exist. So Obamacare is also called the Patient Protection and Affordable Health Care Act. So I'll start with the theory about health insurance in general. Suppose you have an insurance company and a certain number of people sign up for the insurance. They pay a certain amount every month, and then you have a common pool or pile of money, and then if something really bad happens to just one or a few of those people, the insurance will pay out a certain amount of money toward the cost of that person's care, and the amount the insurance is going to pay out is going to be more than the amount the person could have afforded on their own. Now, a lot of people in this country, in the United States, get their insurance from their work. So the employer gets some kind of group health insurance, and the employees don't directly see the cost of the insurance. Some people, like myself, don't get insurance from their work. If you work at a small business where there's less than 50 employees, you probably don't get insurance from your work. The work isn't required to provide you with insurance. So what happens is, like, people who earn only a little bit more than the maximum amount you can get and still get free government handouts get really screwed. So some people didn't have health insurance, and some Democrats felt really guilty about themselves due to the possibility of people not having health insurance. So they decided, they had a few different thoughts. One is to just provide everyone with insurance. If you just provide everyone with some kind of health care or health insurance, and the government's going to have to ration out care. Another possibility is just provide people with health insurance, except that then you'd have to raise taxes. Actually, the Supreme Court defined Obamacare as a tax. What Obamacare does is it forces everyone to have insurance, or they took away the individual mandate, but everyone was supposed to have to be required to purchase health insurance unless you had some kind of hardship or it was going to cost you too much. But so they're going to force everyone to buy insurance, except that insurance is expensive. Some people can't afford it. Now, the first insurance I had cost $130 a month. My mother insisted that I buy it. It was some kind of catastrophic only plan. I thought it was good enough for me, and except it probably didn't cover a lot, but I'm a reasonably healthy person. I'm not that old. It should be good enough. So apparently everyone was required to buy insurance, and if you couldn't afford the insurance, or if you earned below a certain amount, the government was going to give you a subsidy. They're going to pay for all or part of your insurance. Isn't that great? So they have to find a way to pay for the subsidies. So where's the government going to get the money to pay for the subsidies? So the way that the government gets the money to pay the subsidies is they could raise taxes. Republicans won't allow that. So they could increase the cost of the insurance to healthy people who don't use a lot of healthcare resources. So the purpose of the 10 essential benefits is to eliminate the catastrophic only plans so that they can force insurance to be more money, to force the costs to be higher for people like me. And then when the costs are higher, I guess the insurance companies earn more money, so that's great. So then they're gonna vote for the Democrats. And then when the insurance companies earn more money, the government can steal more from the insurance companies in taxes, and then the government uses the extra tax revenue from the insurance companies to afford the subsidies. So the 10 essential benefits are supposed to be ambulatory care. I guess that makes sense for me. I could have a heart attack and die. So actually, my great grandfather with my same last name had a heart attack and dropped dead before he turned 40. The second thing is emergency services. Like, I guess if you go to the emergency room. But if you were really desperately sick, weren't they going to treat you anyways? And the third thing is hospitalization. Well, of course insurance is going to cover hospitalization. I think. I don't know. It depends depends on what insurance you get. The fourth thing is maternity and newborn care. Actually, so technically all insurances, including mine, cover care of babies and childbirth, except that the chances of me finding a woman and having a kid are so low that I don't need this coverage. Mental health and substance use, behavioral health, prescription drugs. I don't currently take any prescription drugs. Rehabilitative and habilitative services to maintain the required skills for daily functioning. I mean, I'm not low functioning. I don't need this service. Laboratory services, preventative wellness or chronic disease management, and pediatric services. I don't need this because I'm almost sure that I'm not going to find a woman to have a kid, and even if I did, I could just buy different insurance. But pediatric services, including oral and vision care. Actually, I read somewhere that it used to be required that people with no kids would have to technically be legally required to buy children's dental care. So a lot of people like myself would be just as well off with lower level of insurance. There's got to be a way to not make healthy people who use few healthcare resources pay so much. Like, it should be the sickest people have to pay the most. Instead, it's the opposite. It's the people who are the healthiest and they're paying the most, and the people who are the sickest supposedly pay the least. So, and actually, my first insurance cost $130 a month. Then it was $148, and then it got over $200, and now it's up to $272 a month. Actually, another thing that might not directly have anything to do with Obamacare is I have something called a PPO that stands for Preferred Provider Organization, and there's something called an HMO that stands for Health Maintenance Organization. So in a health maintenance organization, you legally can't just call a doctor and make an appointment. You're supposed to first call the generic internal medicine doctor, and then the generic internal medicine doctor would have to refer you to a specialist doctor. And I tell people this, and it's like they don't care. It's like they can't wrap their brain around what I'm complaining about. So like if you know you need like a skin doctor or an eye doctor, or I don't know what other doctors, like your nose and throat doctor, you can't just call the specialist doctor and make an appointment if you have a health maintenance organization. But if you pay more money for a preferred provider organization, then you can just call the doctor and make an appointment. And another thing I wonder about is when you go to the doctor's office and they ask you for insurance, it's like they're collecting information about you. That's stupid. One more thing is that it looks like every time you go to the doctor and you give them the insurance, they don't even know how much you're going to be charged, and you get a bill later. But you pay part of the cost and the insurance pays the rest, and they call that a benefit. And but where did they get the money to pay the benefit? They got the money from the premium you paid every month. So almost all the time, for the vast majority of people, the total amount of money you're ever going to pay into an insurance is always going to be more than the amount you get back from them in benefits. So another thing is, so they're collecting information about yours. So they add up the amount of money that you spend in a calendar year, and then when the amount goes over $7,900 for me, then all other expenses for the rest of the year are free. It doesn't even make any sense. Like, suppose in theory I got up to that amount on December 30th, and then something really bad happened on December 31st, and then like it resets on January 1st. That's stupid. Like, they should have the rule be starting from the exact moment you get up to the deductible amount, which is like $7,900 for me. For the next 365 days, everything else is covered, not just for the rest of the calendar year. There's a realistically zero chance of me ever getting up to the deductible amount. So this whole Affordable Health Care Act garbage is an excuse to raise the cost of insurance for healthy people like me so that the government can collect more taxes from the insurance companies, so the government can have the money to pay for the subsidies, so certain Democrats will avoid feeling too guilty about themselves due to the possibility of some people not having health insurance. And also, people who work at small companies where people who earn more money than the maximum amount of money you can earn per year and still get government free handouts get screwed the most, because if you get health insurance from your work, you don't notice the increase in costs. So that's mainly why Obamacare shouldn't exist, is because it was a really nasty scheme to raise the costs of healthy people like myself.